pretty much type in Aetna, join, and it's going to pop up. Healthcare providers join Aetna. Going to pull that up. And then what we're going to do is we're going to go down to behavioral health. Click that. Request for participation. We're going to click Aetna. And we're going to do behavioral health. And it depends. So if you are not contracted or you are contracted, that's when you're going to kind of choose between these. So if you are not participating with Aetna, which means you are not contracted and you are an individual, you're going to click this one right here. Okay. And this is all you need. Very easy here. Okay. So we're going to go through this. So very simple here. See if I can. So we fill this out. Pretty basic information. Hit next. Do you provide telehealth? If you're telehealth only, you want to click this one. Okay. If you want to do telehealth in office, you click the other one. Now, it's not a big deal if you click one and then change it later. Although, if you have the hybrid services, an address may appear. So we are an individual provider under a tax ID that's not participating. We want to be contracted in whatever state it is. Let's pretend it's, for me, let's just guess here and then pull up a zip code, and we'll go with Arizona since it's closer. And then you put the name of your company here or whatever the tax ID is with the LLC, and then your tax ID. So it may give me an error. Let's see. That all filled out. And then you're going to come into your degree type, your specialty. So whatever it is, if it's MSN, that's fine. You put that down there. I don't know why they put APRN. Doesn't make any sense, but just put your degree type. And then your specialty is actually going to fall under a psychiatric nurse. That's how they have it. And then you're going to get you got to click the manual. You don't have to go through it, but it just gives you a bunch of information. Okay, then you fill out this information. Important that you have your CAQH number in there. See that? You can put your website in there if you'd like. And then you could obviously put your all, so you put that all in there. Practitioner is the easiest because, submitter would be easiest because your information is already here. And we fill out this information here. And we fill out your state, address, all that. And then what I always do is I click video, telephone, and 3-way. Remote patient monitoring, we don't do. That's more of a medical thing. We do behavioral health, medication, virtual office. We do nutrition counseling, chronic condition. We do that. The only one I don't select is other telehealth services because it'll ask for specifics. And I usually leave these the same. That means everything is just going to our office. No, these are usually only going to be physicians that have admitting privileges. You attach your W-9. So that's attached. Continue. And then enter in some of your information. If you're family, you can treat all these. Accommodations for disability, usually not if you're doing virtual or at home. If you're Medicaid, Medicare, that's fine. If you don't want to take it, you don't have to. EAP, I don't participate in it because it barely pays you anything. Don't do sign language. You don't speak any other languages. And then you can fill 8 areas out. I always pick the most common ones because that's going to, yield you the most patients seeking care. So we'll just pick a few here just for the sake of doing it. You don't want to pick ones that are the same. You want to pick things that are a little different here. And then submit request. And that's basically it. You're done with the Aetna.